Alberta Primetime with Michael Higgins.
Welcome to Alberta Primetime. Ahead tonight, our politics panel on the Premier paving the way to a sovereignty panel and a future referendum. But first, boosting public awareness.
There's one thing I want to make very clear. Getting immunized against measles is the single most important thing you can do to protect your loved ones and yourself and your community.
And for those that haven't yet immunized, please know this. The risk of measles in Alberta is its highest it's been in nearly 30 years.
Albertans hearing for the first time from the new interim chief medical officer of health as the province ramps up efforts to fight the spread of measles, including a new awareness campaign and making it easier to get vaccinated. Joining us now, Chris Gallaway, Executive Director of Friends of Medicare. Mr. Gallaway, good to see you again, sir.
Hi, Michael. Great to be back with you.
All right. So from a policy standpoint, how do you weigh this as a public health response to the continually expanding measles case count?
Well, for sure, there's no doubt that public education and immunization campaigns are a top priority if we want to tackle measles. So it was great to finally hear something from the Minister of Health and the interim chief medical officer of health yesterday with a plan to do some of those things. But what we saw was still a targeted plan. They're focused on certain zones and regions. What we really need is an all-hands-on-deck scenario. Measles is a very serious disease. It's highly transmittable, and it's something that's entirely preventable through proper immunization, something that we had for decades here in Alberta. We need a province-wide approach that doesn't wait for more cases and more outbreaks, but actually goes full-on right now to try to prevent those cases and outbreaks rather than reacting once they're happening.
What would ramp it up to that all-hands-on-deck scenario? What's missing from the equation?
What we saw yesterday was really a focused push on immunization in the south and central zones. We need to see that province-wide. We need to be focused on proper public education. We need a chief medical officer of health who's independent from government and speaking to media and Albertans regularly with good information. And we need to make it as easy as possible for Albertans to find out, one, if they're fully immunized and protected, and two, to get those shots in arms, protect children, protect our public hospital system from a spike in cases.
How big of a policy priority shift does this represent in relation to the government's approach to provincial immunization campaigns of late and promotion of such?
Mm-hmm. It is the start of a shift, which we're glad to see. You know, last year we saw the immunization campaign spending cut in half. We saw some of the lowest rates of flu shots we've ever had and the highest death rate since in over 15 years from influenza because of that lack of vaccination. When it comes to measles, immunization needs to be the top priority. That needs to be clear to Albertans. We have a situation where, you know, multiple generations now have never even experienced measles. They may not even realize how serious it is, what can happen if you get the disease, and so on. So a robust public education campaign that makes it clear that immunization is a priority needs to happen. And we need to see a government that's not afraid of a small base that is very anti-vaccine. And we need a chief medical officer of health in place that's a permanent officer who speaks to the public regularly and isn't left to stand with the minister in a reactive way, which we saw this week.
Okay, maybe on that last point, Chris, how do you see this playing into the broader dialogue around vaccination rates in Alberta? Moving the needle.
Yeah, absolutely. Vaccination rates in Alberta are low. It's a consistent problem for all sorts of diseases. But now that we're seeing measles come back, this very serious illness, we need to take it seriously. You know, the previous chief medical officer of health, Dr. Joffe, left very suddenly and unexpectedly, and they wrote an op-ed calling for action. And now we've seen some action this week following that. But why wasn't he speaking publicly earlier? What was that barrier? Was it a political choice? We're not really sure what happened there. But what we need to see from our government is an evidence-based, science-based push on public health. And we need to know that the chief medical officer of health is leading that charge. Okay. And right now, it's very unclear.
And this is the first time Albertans have heard from the new interim chief medical officer of health. How do you assess the role of health leadership to this point?
We heard some good words yesterday. We did not see a robust plan that we think is needed. Having over 265 cases in Alberta is a huge number. the highest we've seen in generations. We should be seeing a much more urgent response than we saw yesterday. And we should be seeing regular updates from the Chief Medical Officer of Health, regular press conferences or other communications with the public, not just standing with the minister once in response to what's happening.
This comes amid the overhaul of healthcare in our province. How do you see the new measles response maybe playing with the government moving public health away from AHS to the new agency Primary Care Alberta, a component of the recently tabled Health Statutes Amendment Act?
Yeah, we saw that new legislation last week that's tabled and we assume will be passed by next week. That really brings public health more under the control of the minister and under the government rather than a third-party agency that Albertans can know is focused on evidence, on science, on best practices. We really need to take the politics out of public health and focus on how we keep children safe, Albertans safe, and protect our public health system from these infections that have been putting that extra burden on our hospital system year after year.
All right, we'll have to leave it there. Appreciate your time this evening, Mr. Gallaway, as always. Thank you.
Great. Thanks for having me back, Michael.
Chris Gallaway, Executive Director of Friends of Medicare.